Hi, this is another edition of DocTalk. In this edition, we're going to talk about the 10 top medical breakthroughs of 2013. Now, I'm going to let this natural reader thing read it to you because my pronunciation is so bad. This thing's got to do a little better than I do. But I'm going to let it read it to you. Please let me know if you'd rather me read this stuff or what. So, here we go. Let's give it a listen.
A handheld optical scanner to detect skin cancer, bladeless cataract surgery, and an amazing new headache treatment are among the top 10 medical innovations for 2013 selected by a panel of Cleveland Clinic scientists and researchers. A surprising government program also made the list, unveiled at the clinic's Medical Innovation Summit. To qualify, the breakthrough had to offer a major improvement in patient care, have a high probability of success, and must either be on the market now or be close to being introduced. Here's a look at the remarkable therapies and game-changing technologies expected to dramatically reshape healthcare and save lives over the next year. Number 10. Financial rewards for healthy choices. About 96% of Medicare's budget is spent on treating people with potentially preventable chronic diseases. The bipartisan Medicare Better Health Rewards Program Act of 2012 presented Congress offers a new approach to improving health and cutting costs. The 3-year program uses the annual wellness visit Medicare already covers to motivate patients to improve 6 areas of health: BMI, body mass index, blood pressure, diabetes indicators, vaccinations, and smoking. By saving Medicare money, participants who take steps to boost their health in these areas will be paid up to $400 after checkups in the program's 2nd and 3rd years. 11 ways to save money on healthcare. Number 9. 3D mammography. Also called breast tomosynthesis. This new diagnostic imaging technology received FDA approval in 2011. It can be performed along with a traditional mammogram for more accurate screening. The X-ray arm of the machine makes a quick arc over the breast, taking dozens of images at various angles that are then merged into a 3D image. Preliminary study results in 25,000 women report a 47% rise in cancer detection when tomosynthesis was used. Number 8. Modular stent for aneurysms. Aortic aneurysms, weak, ballooning areas in the heart's largest artery are often fatal if they rupture. The preferred treatment for large aneurysms, those 5.5 to 6 centimeters in diameter or more, is a minimally invasive procedure to insert a stent graft in the affected area, but stents currently on the market aren't suitable for up to 40% of patients due to their anatomy. A new modular stent now in multi-center trials allows surgeons to treat these complex aneurysms, thus saving the lives of high-risk patients. 7 warning signs of a heart attack. Number 7. Ex vivo lung perfusion. Many people who need lung transplants can't get them due to a shortage of donor organs. Often because of complications that make lungs unsuitable for transplantation, these organs are only harvested from 15% of deceased donors. The new lung washing technology ex vivo lung perfusion can reverse injuries in donor organs by treating them with proprietary fluid, if needed, medications to clear infections. Experts estimate that up to 40% of lungs currently rejected for transplant could be repaired with this technology, which is already approved in Europe and Canada. Number 6. Femtosecond laser surgery for cataracts. Operations to treat cataracts, clouding of the eye's lens, are the most common surgical procedures in the United States and improve vision in more than 95% of cases. The new FDA-approved bladeless technology already used for LASIK eye operations uses pulses of light lasting 1/4 of a second to femtosecond for more precise cataract surgery. Not only is the laser technique more accurate than traditional cataract surgery with a blade, but it also causes less inflammation and provides more stability when doctors implant an intraocular lens. Number 5. Handheld optimal skin for melanoma. More than 76,000 Americans develop melanoma, the deadliest form of skin cancer, annually, and 9,600 die from it. A new FDA-approved handheld device uses imaging technology developed by the military to guide the soul for non-invasive analysis of moles and suspicious skin areas. Light of 10 different wavelengths penetrates the skin, then computer software compares the finding to 10,000 archived images of melanoma and other skin cancers. In a clinical trial of 1,300 patients, the device correctly identified 98% of melanomas.
Now, how did they do that? Use imaging technology developed by the military to guide missiles for non-invasive analysis of moles and suspicious skin areas. How did they make that leap of working there? That's bizarre. Wow. But let's continue.
Number 4. Better drugs for advanced prostate cancer. In the past 2 years, however, 5 new drugs have been approved for advanced prostate cancer: sibutramine, denosumab, abiraterone, cabazitaxel, and enzalutamide. Many experts believe that these drugs and others in the development pipeline could ultimately turn advanced prostate cancer into a manageable chronic disease. 9 tips to prevent prostate cancer. Number 3. Mass spectrometry to identify bacteria. When a patient has a dangerous bacterial infection, getting a rapid diagnosis and the right medication could be life-saving. In the past, culturing bacterial could take days. Mass spectrometry lab technology has made it possible to accurately identify bacteria in a patient's sample in minutes, at a cost of just 50 cents. Number 2.
A cost of just 50 cents. Wow. And instead of making number 4 there, advanced prostate cancer, instead of making it a controllable chronic condition, let's cure it. My gosh, what's wrong with these people? They want a constant supply of money. They want you as a patient for life.
Neuromodulation therapy for severe headaches. For patients with excruciating migraine or cluster headaches, a tiny, almond-sized implant can block the pain without drugs. The nerve stimulator is placed inside a small surgical incision in the upper gum. Then patients activate the pain-blocking implant with a remote control whenever they feel a headache coming on. In European studies, 68% of patients with cluster headaches responded to neuromodulation therapy with pain relief, fewer headaches, for both. The device is now being studied for migraines as well. Number 1. Bariatric surgery to control diabetes. After noticing that weight loss surgery often helped patients with type 2 diabetes reverse their disease often before they even left the hospital, doctors
And that's bariatric surgery. Sorry.
began investigating this operation as a treatment for obese patients with poorly controlled type 2 diabetes. 2012 study results published in New England Journal of Medicine astounded the medical world, says Cleveland Clinic. Compared to diabetic patients who received medications and lifestyle counseling, those treated with bariatric surgery were far more likely to be free of diabetes and often lowered their cholesterol and blood pressure as well. Many experts believe this surgery might even be a cure for type 2 diabetes.
A cure for type 2 diabetes? Then that means that type 2 diabetes has everything to do with eating alone and how much you eat. Because bariatric surgery has to deal with making your stomach smaller so that you can't eat as much food. So, if they can cure type 2 diabetes by making your stomach smaller, then they've been lying to us about a few things. Anyways, I'll put the link to this article down below. I hope everyone's having a great day and happy Sunday. This is the top 10 medical breakthroughs for 2013. And this is DocTalk. Have a great day.